Roberto Diletti and Mike Gibson coming to you live from ACC 2026, and we're talking about the use of Ivus and complex procedures, the Ivus chip trial. Roberto, talk to us a little bit about what you did.
So first of all, thank you for having me. We are talking today about the Ivus chip trial, which was an investigator-initiated, multi-center, international, open-label, event-driven, randomized control trial comparing Ivus-guided PCI versus angio-guided PCI in patients undergoing complex and high-risk PCI. This trial enrolled patients that were older than 80 years, presenting with silent ischemia, stable angina, unstable angina, or non-ST elevation acute myocardial infarction. Those were the eligibility for criteria for this trial, and some anatomical criteria were used to identify complex lesion, coronary complex lesion. Those criteria were severe calcification, ostial lesion, true bifurcation lesion with a side branch of at least 2.5 millimeter in diameter, left main coronary artery lesions, CTOs, in-stent restenosis, and long lesion. Long lesion were defined as lesion more than 28 millimeter in length.
And how many patients did you randomize, and what did you find?
So yes, we randomized 2020 patients. This was a study that went from November 2021 through August 2023. I'm talking about the enrollment, and 2020 patients were enrolled in 37 centers in 7 European countries. So those were the number, and what is important to say is that pre-specified optimization criteria were predefined for the patient undergoing Ivus guidance, Ivus-guided PCI. And those criteria were basically 3 criteria. The first one was a final minimal stent area more than 5 square millimeter, or a minimal stent area more than 90% of the distal reference lumen. The second criteria was a plaque burden that was less than 50% within 5 millimeters at the proximal or distal stent edge, and of course no relevant edge dissection involving the media, and more than 3 millimeters in length. So this was the study design. Maybe you want to know more about the findings.
What do you find?
We have seen. So yeah, first of all, we have seen that those patients, they had a mean age of 69 years. Many of them were presented with acute coronary syndrome. Non-ST elevation myocardial infarction were roughly 20% of the population. Another important thing is that many of them, they were diabetic. We had 20% of non-insulin dependent diabetic and around 9% of insulin dependent diabetic. So it was quite a high rate. And also patients with previous PCI, they were 47% in each group. And also patients with previous myocardial infarction. They were roughly 30% in each group. So quite a complex population, but also, I would say, a complex lesion population. Because if we look at the SINTA score of those patients, we see that they had a SINTA score that was roughly 25 in both groups. So quite high, I would say. And another important point is the calcification, the rate of severe calcification. In the Ivus group, we have a rate of almost 46% of patients with severe calcification, In the angio-guided PCI are around 42% of severe calcification. So this marks, I think, an important difference with previous trials, because we see that we have a really high rate of complex lesion and complex patients. What we found in terms of clinical outcomes. The primary endpoint of this trial was target lesion failure. The target lesion failure was defined as a composite of death from a cardiac cause, target vessel myocardial infarction, or clinically indicated target vessel revascularization. So it's a classic endpoint to assess the performance of our treatment, of the PCI treatment. And what we have seen is not in line with previous trials. At a median follow-up of 19 months, we have seen that the rate of target vessel failure was 13.9% in the Ivus group and 11.1% in the angiography-guided PCI group, with a p-value of 0.08. So basically, the use of Ivus was not improving clinical outcomes in this group of patients. We had an interesting finding that was the rate of stent thrombosis. We had 2 stent thrombosis basically in the Ivus-guided group and 10 in the angio-guided group, so 0.2% in the Ivus, 1% in the angio group. So yeah, the stent thrombosis was less, but the overall clinical outcome of those patients was not improved as per the primary endpoint of this trial.
Well, this is important because it was an investigator-initiated study, free of industry support, and gives you an answer that's somewhat different than we've seen in some trials, but not all trials. Not all trials show a benefit of Ivus.
Right.
So, for older operators like me who decided, well, I'll just upsize my stent by about 0.25 millimeters and be done, this is somewhat reassuring. Well, thanks so much for joining us today, Roberto. I appreciate it.
It was a great pleasure. Thank you.